This is something I've been talking about and doing research on for a long time. I'm teaching a sophomore seminar this semester on health disparities, which is a lot of fun. I don't see any of my students in the audience, so they won't have to hear what they've heard before, which is always a good thing. I only want to make, I think I have 5 points, and it was interesting getting everything I wanted to talk down to 10 minutes. So the first point is the gradient. And this is the simple fact that a lower a family's income, the more likely children in that family are in poor health. People probably know this, maybe it seems obvious, but a lot of people think of this when they think of it as to do with poverty, only poverty. And when you actually look at the numbers, and this is income on the scale, this is the fraction of children who are in excellent or very good health, the fraction of children who are in poor health. And these are kids age 0 to 2, 6 to 8, 12 to 14. It goes up like that with age. I want you to notice 2 things. One is the fraction of children this is excellent or very good health. The fraction of children who are in excellent or very good health increases constantly with income. It's not just about poverty, it happens all along the income spectrum. The other thing is that, and I went the wrong way, I'm sorry, I show these graphs in different ways. These are the youngest kids and these are the older kids. Unfortunately, as people get older, their health status deteriorates. This happens the whole way through the age range. But the thing that's important to notice is that among low-income families, the decline in health status as children get older is much larger than it is among the wealthiest families. So there's an income gradient in health. It gets worse and more pronounced with age, and much more so for lower income children. You can do the same thing with many different measures of health. Okay, point number 2. This is what I call the double disadvantage, which is, yes, it's true that poorer children have worse health problems, more health problems. The consequences of those health problems are worse for poorer children than wealthier children. So double disadvantage, more likely to have problems, the consequences of problems are worse. I'm going to talk about this, I sort of break these 2 things into those 2 bits. What's the likelihood that how much more likely are poor children to have chronic health conditions, and how severe are those chronic conditions relative to other children? These severity effects actually dominate, especially for conditions like asthma, diabetes, and epilepsy that are difficult to manage. Just to give you a sense of the data, because I do like data, this is the fraction of children who are reported by their parents to be in excellent or very good health. You can get similar results with doctor reports. These are kids with and without asthma, lowest income quartile up to the highest income quartile. 2 points here. One is the wealthier families the more likely children are to be in excellent or very good health. That's true whether children have asthma or don't have asthma, right? Having asthma reduces health status across the board. But the other thing that we see here is that among the wealthiest children, the impact of asthma on being reported to be in good health is much smaller than it is among the lowest income children. The same thing is true if you look at hospital episodes, okay? So if you're a low-income kid with asthma, you're 8 percentage points more likely to have a hospital episode than a child without asthma. If you're a wealthier child with asthma, that difference is only 3 percentage points. We can talk in the Q&A about why that might be, but it's something where you see, okay, there's something going on with the management of conditions, access to care, the quality of care, that means that if you have a chronic health problem in your childhood, it has a worse effect on you if you're poor. So what are the consequences? This is something I've spent a lot of time doing work on, which is, children with health problems, what does it mean for them over the course of their lives? And a lot of research, my own and other people's research, shows that children with health problems are at risk of attaining lower socioeconomic status as adults. And what does that mean? It means that they're more likely to have lower educational attainment. They're more likely to be unemployed as adults. They're more likely to have lower earnings. This is just a little snippet of data, but it gives you a sense of the kinds of results that are out there. This is the probability of falling behind a grade level of school of low birth weight children relative to their low birth weight siblings. So this is within families, right? And you may think, what's the big deal about falling behind a grade level in school? Falling behind a grade level in school is the single biggest predictor of not graduating from high school, right? You fall behind, you hit the age where you want to go, and you haven't got a degree. So when you look at this, at age 8, there hasn't been much opportunity to fall behind in school. Very little difference. By the time kids are 14, there's about an 8 percentage point difference between low birth weight and non-low birth weight siblings in the probability of having fallen behind. That difference gets bigger as kids get older. If you look across a lot of data that tracks people from children into adulthood, and this is based on work that I've done largely in Britain, but there, again, there's a lot of work done in the US, which is when you look at poor health in childhood, no matter how you measure it, prenatal smoking, low birth weight, stunting in early childhood, chronic childhood health conditions, what you find is that that is associated, controlling for a bunch of other things, with lower educational attainment, lower labor force participation, lower occupational status, more in blue collar and lower service level jobs, lower earnings, and poor health throughout life. Just to give you some sense of the numbers here, if you look at some of the work we've done, you say, okay, let's take a child exposed to prenatal smoking, born at low birth weight, has a chronic condition during childhood. Well, that child is predicted to have 30% lower earnings at age 33 and be 13% percentage points less likely to be employed. So these are pretty big effects. There's some really good work done in the US that looks at low birth weight. Within sibling pairs, low birth weight is associated with a 17.5% reduction in adult earnings. Again, really big effect. So, fourth point, the cycle. And the point here is that poor health in childhood is a route for the intergenerational transmission of poverty. So think about it the following way. You start with poor health in childhood. That produces lower educational attainment, worse health in adulthood, worse economic status in adulthood, lower income in adulthood. And then you have adults who are having children who are born into lower income households who then have poor health in childhood. You can just keep going around in circles. Right? And so a lot of my work has been focused on how do we think about this cycle? How do we think about breaking it? And what's the best place to break it? Because you could think about attacking it here, here, or here, right? I'm an economist. I think, what's going to be the most effective, the efficient way from a policy point of view to do that? And this is just a summary of where I think the best points are to break the cycle. Going from lower educational attainment and trying to break that link into low income in adulthood, that's really, really hard. Right? There's some things you can do, but it's hard. Trying to help children who are in poor health have better educational and health outcomes as adults. There's some good interventions there. Again, the older children get, the harder it is to have an impact. I think the best place to really think about breaking the cycle is to make sure that poor children, children born into poor families, have the best possible health outcomes that they can. When I think about health, I think about health and developmental outcomes together, just to be clear on this. So, what are the kind of programs? I'm running out of time, but I will tell you some of the things that I think are the most promising. There's a lot of data, very good evidence that Medicaid and prenatal care expansions have had very large effects on the health of babies at birth. Again, cost-effective even though expensive. Home visiting programs, a lot of work that looks at the impact of having nurses, other trained professionals come into people's homes early on, especially for children who are at high risk of health problems and developmental problems. First-time mothers, low-income mothers, people who've had problems with abuse and neglect in their families in the past. High-quality child care, something this country has to invest in. Nutrition programs like WIC. And then I would also talk about some of the environmental health issues that people actually hear. A Brown study, I think of the work that's been done on lead poisoning in Rhode Island and the very severe consequences that has on the health and development of children. So there are things we can do. Again, can't go into all of them, but I think the bottom line here is that investments in very early childhood health and development, from an economic point of view, have long-run payoffs. And just from a kind of ethical point of view, these are things that just have huge effects on the quality of people's lives. So.